Hello, welcome to this segment of Code Rhetoric with Tam Talk. Hi, my name is Tamara Abraham, founder of Abraham Medical Coding Coach. In this segment, we are still focusing on sepsis. However, we're going to go a little bit deeper and focus on sepsis with localized infection. Our ICD-10 General Coding Guidelines states, if the reason for admission is both sepsis or severe sepsis, and a localized infection such as pneumonia or cellulitis, a code or codes for the underlying systemic infection should be assigned first, and the code for the localized infection should be assigned as a secondary diagnosis. If the patient has severe sepsis, a code from the subcategory R65.2 should be assigned as secondary diagnosis. If the patient is admitted with a localized infection such as pneumonia and sepsis or severe sepsis doesn't develop until after admission, the localized infection should be assigned first, followed by the appropriate sepsis or severe sepsis codes. In our first coding example, our patient presents for management of severe sepsis and pneumonia. So when we do our first book step, we're going to locate the pneumonia, which is our localized infection. Our ICD-10-CM code should be J18.9. And in our second book step, we're going to locate sepsis, and then we're going to locate the type of sepsis, which is severe. And our ICD-10-CM code should be R65.20. Our rationale is the patient presented with severe sepsis and pneumonia, and per guidelines, we are to assign the localized infection as primary diagnosis and severe sepsis as secondary. Therefore, the coder should assign code J18.9, which represents the pneumonia, as our primary diagnosis, and R65.20, which represents severe sepsis, as our secondary diagnosis. So here in our second coding example, our patient presents for management of cellulitis of the chest wall. However, on the third day of inpatient stay, the patient developed both sepsis and severe sepsis. So in our first book step, we're going to again locate our localized infection, which is pneumonia, and our ICD-10-CM code should be L03.313. In our second book step, we're going to locate sepsis, and our ICD-10-CM code for that should be A41.9. And then in our third book step, we're going to locate sepsis, and again, we're going to define the type of sepsis, which is represented by severe, and our ICD-10-CM code should be R65.20. In our rationale, again, our patient presented with cellulitis of the chest wall. Again, per coding guidelines, we are to assign the localized infection as primary diagnosis and assign codes for both sepsis and severe sepsis as secondary. When assigning the sepsis and severe sepsis codes, the guideline also instructs us to code first the sepsis and then code severe sepsis as tertiary or third. Therefore, the coder should assign code L03.313, which represents our cellulitis, as our primary diagnosis, A41.9, which represents our sepsis, and then as secondary, and then R65.20, which represents our severe sepsis, as our tertiary or third diagnosis code. And so the reason for our sepsis and severe sepsis being assigned to our second and third placeholders, again, the patient actually presented for cellulitis of the chest wall. However, during the course of their inpatient stay, they also developed sepsis as well as severe sepsis. So our cellulitis is going to be our primary diagnosis, which is why, or the primary reason why the patient is being treated. And then our sepsis and severe sepsis are representing the diagnosis or the issue or illness that developed during the inpatient stay. So in our third and final coding example, our patient presents for management of cellulitis of the buttock as well as sepsis with severe sepsis. So in our first book step, we're going to locate sepsis, which is represented by ICD-10-CM code A41.9. In our second book step, again, we're going to identify sepsis. However, we need to specify the type of sepsis. and in this case it is severe sepsis. Our ICD-10-CM code should be R65.20. And in our third and final book step, we're going to locate cellulitis. And again, we need to specify the type of cellulitis. And in this case, the patient has cellulitis of the buttock. Therefore, our ICD-10-CM code should be L03.317. Our rationale for this example is, again, the patient presented with cellulitis of the buttock along with sepsis and severe sepsis. Per guidelines, we are to assign codes for both sepsis and severe sepsis as primary diagnoses and assign the localized infection as secondary. When assigning the sepsis and severe sepsis codes, the guideline also instructs us to code first the sepsis and then code severe sepsis as secondary. So therefore, the coder should assign code A41.9, which represents sepsis, as the primary diagnosis, R65.20, which represents the severe sepsis, as secondary, and L03.317, which represents the cellulitis of the buttock, as our third diagnosis. In this particular scenario, the patient presented with all three diagnoses prior to admission. So therefore, based upon the guideline, the rules change for assigning the codes in this particular scenario. So in our coding tips, our first reads, if the reason for the encounter is to manage both sepsis and severe sepsis, along with the localized infection, then code both sepsis and severe sepsis as our primary and secondary diagnoses. The localized infection should be listed as an additional diagnosis. The second tip, if the reason for the encounter is to treat the localized infection and the patient develops sepsis after admission, then the localized infection should be listed as primary or first listed diagnosis, and sepsis and severe sepsis should be listed as our secondary diagnoses. As always, remember to code to the highest specificity, and when in doubt, always reference your coding guidelines. This concludes our segment of Code Rhetoric with Tam Talk. To learn more, please subscribe to our YouTube channel at Abraham Medical Coding Coach Abraham, or visit our website at www.abrahammedicalcodingcoachllc.com, and be sure to follow us on Facebook, LinkedIn, and Instagram. Thank you.